Welcome to this pharmacology quiz on sulfonamide antibiotics, part of our ongoing pharmacology quiz series. In this video, we will review key drugs in the sulfonamide class and the infections they are used to manage, including urinary tract infections, pneumocystis pneumonia, and certain bacterial infections. The quiz contains 10 recall-type multiple-choice questions designed to test your pharmacology knowledge. Each question includes 5 options, followed by the correct answer and a brief explanation. The video will pause for a few seconds after each question so you can attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which of the following statements correctly describes the mechanism of action of sulfonamide antibiotics? Option A. They inhibit bacterial DNA gyrase during DNA replication. Option B. They inhibit dihydrolate reductase directly. Option C. They competitively inhibit dihydropterate synthase in folate synthesis. Option D. They bind the 30S ribosomal subunit to block translation. Option E. They inhibit bacterial cell wall peptidoglycan synthesis. The correct answer is option C. They competitively inhibit dihydropterate synthase in folate synthesis. This is because sulfonamide antibiotics are structural analogues of para-aminobenzoic acid and inhibit dihydropterate synthase, thereby blocking bacterial folate synthesis required for DNA production. All other options describe mechanisms of different antibiotic classes such as fluoroquinolinase, trimethoprim, aminoglycosides, or beta-lactams. Question 2. Which of the following statements about sulfonamide antibiotics pharmacokinetics is correct? Option A. They have poor oral absorption in humans. Option B. They are rapidly destroyed by gastric acid. Option C. They achieve minimal penetration into cerebrospinal fluid. Option D. They are metabolized mainly by hepatic acetylation. Option E. They are eliminated exclusively by biliary excretion. The correct answer is option D. They are metabolized mainly by hepatic acetylation. The explanation is that many sulfonamides undergo hepatic acetylation before renal excretion, which influences their pharmacokinetics and potential for crystalluria. All other options are incorrect because sulfonamides are generally well absorbed orally, not destroyed by gastric acid, can penetrate body fluids including CSF, and are primarily renally excreted rather than exclusively via bile. Question 3. Which of the following drugs is combined with trimethoprim to produce sequential blockade of folate synthesis in antibacterial therapy? Option A. Sulfadiazine. Option B. Sulfamethoxazole. Option C. Sulfadoxine. Option D. Sulfasoxazole. Option E. Sulfacetamide. The correct answer is option B. Sulfamethoxazole. This occurs because sulfamethoxazole inhibits dihydropterate synthase while trimethoprim inhibits dihydrolate reductase, creating sequential blockade of folate synthesis and producing bactericidal synergy. All other listed sulfonamides are not routinely paired with trimethoprim in the commonly used fixed combination known as cotrimoxazole. Question 4. Which of the following statements about adverse effects of sulfonamide antibiotics is incorrect? Option A. They may cause hypersensitivity reactions and skin eruptions. Option B. They can precipitate hemolysis in G6PD deficiency. Option C. They frequently cause irreversible ototoxicity. Option D. They may cause crystalluria in poorly hydrated patients. Option E. They may cause kernicterus in neonates. The correct answer is option C. They frequently cause irreversible ototoxicity. The reason is that irreversible ototoxicity is classically associated with aminoglycoside antibiotics rather than sulfonamides. All the other options describe recognized adverse effects of sulfonamides including hypersensitivity reactions, hemolysis in G6PD deficiency, crystalluria, and kernicterus risk in neonates. Question 5. Which sulfonamide antibiotic is topically used in ophthalmic infections because of its high ocular penetration? Option A. sulforacetamide. Option B, sulfamethoxazole. Option C, sulfadiazine. Option D, sulfasoxazole. Option E, sulfadoxine. The correct answer is option A, sulforacetamide. This is because sulforacetamide is formulated as ophthalmic drops and achieves effective concentrations in ocular tissues for treating bacterial eye infections. The other drugs listed are primarily used for systemic antibacterial therapy rather than topical ophthalmic use. Question 6. Which statement about sulfonamide antibiotics in pregnancy and neonates is correct? Option A. They displace bilirubin from albumin in neonates. Option B. They are first-line agents in neonatal infections. Option C. They enhance bilirubin conjugation in the liver. Option D. They are routinely used in prematic infants. Option E. They reduce bilirubin neurotoxicity risk. The correct answer is option A. They displace bilirubin from albumin in neonates. This is because sulfonamides can compete with bilirubin for albumin binding sites, increasing free bilirubin and risking kernicterus in newborns. All other options are incorrect since sulfonamides are generally avoided in neonates and do not enhance bilirubin metabolism or reduce its neurotoxicity. Question 7. Which of the following statements regarding sulfonamide antibacterial activity is correct? Option A. They inhibit bacterial folate synthesis from para-aminobenzoic acid. Option B. They inhibit bacterial ribosomal translocation during translation. Option C. They block bacterial DNA supercoiling via topoisomerase inhibition. Option D. They disrupt bacterial membrane permeability directly. Option E. They inhibit synthesis of bacterial peptidoglycan crosslinks. The correct answer is option A. They inhibit bacterial folate synthesis from para-aminobenzoic acid. The explanation is that sulfonamides act as structural analogues of para-aminobenzoic acid and block the enzyme dihydropterone synthase in bacterial folate synthesis. All other options describe mechanisms belonging to different antimicrobial classes such as macrolides, fluoroquinolines, polymyxins, or beta-lactams. Question 8. Which of the following statements about cotrimoxazole compared with sulfonamide monotherapy is correct? Option A. It combines sulfamethoxazole with a beta-lactam antibiotic. Option B. It produces bactericidal activity through sequential enzyme inhibition. Option C. It reduces folate synthesis inhibition compared with sulfonamides alone. Option D. It eliminates hypersensitivity reactions seen with sulfonamides. Option E. It prevents crystalluria caused by sulfonamide therapy. The correct answer is option B. It produces bactericidal activity through sequential enzyme inhibition. This occurs because the combination of sulfamethoxazole and trimethoprim blocks two sequential steps in bacterial folate synthesis, enhancing antibacterial efficacy. All other options are incorrect since the combination does not include beta-lactams, does not reduce folate inhibition, and does not eliminate hypersensitivity or crystalluria risk. Question 9. Which of the following drugs is a non-antibiotic sulfonamide derivative used for diuretic therapy rather than antibacterial treatment? Option A. Hydrochlorothiazide. Option B. Sulfadiazine. Option C. Sulfamethoxazole. Option D. Sulforacetamide. Option E. Sulfasoxazole. The correct answer is option A. Hydrochlorothiazide. This is because hydrochlorothiazide is a thiazide diuretic derived from the sulfonamide chemical structure but used to treat hypertension and edema rather than infections. The other options are sulfonamide antibiotics used primarily for antibacterial therapy. Question 10. All of the following statements about sulfonamide antibiotics are correct except Option A. They act as structural analogues of para-aminobenzoic acid. Option B. They inhibit bacterial dihydropterone synthase competitively. Option C. they are bacteriostatic when used alone. Option D, they require bacterial uptake by active transport. Option E, they interfere with folate synthesis in bacteria. The correct answer is option D, they require bacterial uptake by active transport. The explanation is that sulfonamides act extracellularly by competing with paraaminobenzoic acid and do not rely on specific active transport mechanisms to enter bacteria. All other options accurately describe established pharmacological properties of sulfonamide antibiotics, including their mechanism and bacteriostatic nature. The quiz is complete now, and thank you for taking part in this pharmacology challenge on sulfonamide antibiotics. Be sure to drop your score in the comments so I can see how you performed. To strengthen your understanding, consider reviewing trusted pharmacology references such as Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. If you found this quiz helpful, be sure to subscribe for more pharmacology revision and learning content.